Greetings, this is Dr. Newmeyer. This is the fourth in a series of 4 videos or YouTubes. In this one, probably be the briefest of all my 4. I want to just take you through what a report that I might write up based upon a battery of tests. And so here I have a fictitious client, Howie Smith, date of birth 7/13/89, his gender, and the report date. So this is the date that the um, report was actually generated. So when all the tests were finally put together and the data was written up, the name of the examiner. There could be in work you do where you are the examiner, but somebody else writes the report, in which case you would have multiple names on a document. And then the tests that were administered and when they were administered. And you can see I just put June 2010, which indicates to me that I probably did this over a series of a couple sessions. In this particular case, I conducted a clinical interview. So oftentimes when I'm doing testing or evaluation, that will include some kind of structured or semi-structured interview. A reason for the testing, background and significance, and any other collateral information that would help me understand the client, especially as I administer the instruments, and then write this report. And so I think that most test assessment batteries or reports that are written up will have a format that's very similar to this, where you have the client's identifying information and the individual that administered and the report and the instruments that were administered in a write-up. In your own case, you're just going to probably, for this class, have 2 things here. So you might just say you'll have a clinical interview, you know yourself, so you can kind of just like make that up as you go, but you don't have to, you know that information. So a clinical interview and maybe an MMPI, in the Minnesota Multiphasic Personality Inventory. Please write it all out, as well as abbreviate it, just to make sure that everyone knows what these instruments are. And even though you can see here, I gave a MIDI mental status exam and adult intelligence test in addition to the MMPI, it's not uncommon for me to have occasions where all I do is a structured interview or a semi-structured interview and administer one instrument like the MMPI or like an educational test or some other kind of inventory. So while this one is an example of using multiple instruments, it's not uncommon for me to write a report that just has an interview and one instrument. And so then what I like is the format where I summarize the presenting problem. What is it that brought the client to me for the testing and evaluation? What were some behavioral or verbal observation I have of the client? And then the clinical interview. And again, I try to provide, these are just very factual, so I'm not interpreting in any of this. This is very much just me trying to be as factual as I can and understanding what brought the client in. So as you can see in the presenting problem, I even used a quote here. So I know people are trying to manipulate me, as a quote the client said. I shouldn't say things that maybe I say things that maybe I shouldn't, and feelings of being immobilized and stuck. So the client came to me under some of these conditions. People are hiding things from me, so you can see how I have a lot of quotes in there. If you're perhaps testing a child, maybe this information will come from the child as well as a parent or a guardian. So you could have other people that are providing information on the presenting problem, or maybe a referring agency or physician, something like that. Again, behavioral and verbal observations that I gather throughout the clinical interview as well as the testing protocol, I'll report there. And sometimes these sections are shorter or longer, but typically they aren't super long. I like them to be as concise as possible, realizing that other people have to read these reports and don't want to spend all day. They want to get right to it. And so then I have a little bit more language in here about the clinical interview, and where I asked the client to tell me about what was going on with more specificity. And then I will have a test results section. So Again, this one starts off with a general interpretation of his WACE results, and then a little bit more specificity into the WACE, the verbal and performance, and so on. And then the MMPI profile, and you will notice that in the MMPI profile, I do not, this is a narrative report. I am not providing every piece of information in the MMPI, but only talking about those things that are relevant to why the client is testing. So when you write these reports, you do have to think about your audience in mind. So for instance, if this is going back to a school, I'm going to try to write this from a perspective that an educator can make sense out of what I'm writing. If I'm writing this to another counselor or psychologist, I'll write with maybe a little bit more language that would be appropriate for those professions. If I'm writing this to an employer or to a court, so these are some of the, or maybe a physician. So you do need to keep in mind who your audience is and the specificity that you go into in this report. Also, usually then you have to remember that this report should go to the client. The client should get a copy of this report. So when I write this report like this and I then follow up with an additional session with the client, I will provide them a copy of the report. And you can read then my understanding of the MMPI here. Some other instruments that I administered were the mini mental status exam. And I do abbreviate the instruments in the report because I provided their full name at the top. So I don't write out mini mental status exam typically, although I suppose I could. And so after I've been, again, very factual and reporting all the information on the instruments in a very factual way, remembering my audience and target of the individuals that will be reading it, I then have to bring that all together into a summary and conclusions, which will then lead me to recommendations and treatment. In this instance, this was an individual who was experiencing the onset of schizophrenia, common age at which sometimes schizophrenia occurs is in young adulthood, especially in males. And so my assessment was that we were seeing the onset of adult schizophrenia. And so my recommendations and treatment summarized, my summary and conclusions summarized the testing and the clinical interview, and then I made appropriate recommendations and treatment considerations, and that's my report. And then, of course, a signature line that should include your name and your credentials, and probably there should be a date on this, even though there's a date at the top of this report. I should probably have a date line on there for my own signature too. Oftentimes when I'm writing these reports and I debrief the instruments and go over the report with the clients, I will make additional corrections and additions to the report as I'm debriefing the instrument with my in the debriefing session, and then make those final edits and adjustments based upon that interaction with the client. And then that'll be my official report then that stays in the chart and is sent out to others. Again, sometimes you'll have different versions of these reports depending on whether this is going to an educator, another mental health professional, a medical doctor. It's being used in forensic work. So that does make a difference. I can tell you these reports get pretty easy to write if you do it a lot, because you kind of develop your templates. So I have templates for writing. And so if I know this is going to be like I'm assessing a child and it's a custody situation and there's a divorce or something like that, I have a template that I would use for that, which kind of gets at some of the things that I think the courts are often more looking at than maybe if this was going to a school because they were concerned about a student performance. Okay, I hope this has been helpful in a battery and how to write it up or a test report.